Assalamualaikum, my name is Muhammad Khairul Anam bin Samian. Today I will present about MRI artifacts. Introduction. MRI artifacts are image distortion or errors that do not correspond to actual anatomy or pathology. They can arise from patient movement, hardware limitations, or the physical principles of MRI itself. Artifacts may reduce image quality, obscure important details, or even mimic disease, making it crucial for radiologists and technologists to recognize and manage them effectively. Artifacts can be classified into three. One is patient-related artifact, then hardware-related artifact, and protocol-related artifact. Patient-related artifacts are caused by such factors as patient movement, which is the patient breathing, swallowing, and voluntary movement. Then flow artifacts such as blood or CSF pulsation, and also implants such as dental filling, prostheses, or clips contribute to MRI artifacts. For hardware-related artifacts, it may caused by magnetic field inhomogeneity, that non-uniformities in main magnetic fields. Another one is gradient malfunctions, which is by imprecise gradient encoding. For protocol-related artifact, there are three. Number one is aliasing artifact, which cause tissue outside FOV map incorrectly. Another one, chemical shift artifact, that will show misregistration between fat and water signals. Last, the susceptibility artifact, which cause the distortion from air tissue or interfaces. Distortion from air tissue interfaces or metal interfaces. For first artifact that will be discussed is patient motion artifact. That is by patient-related artifact. It is caused by involuntary movement, such as breathing, heartbeat, swallowing. It can also be by voluntary motion, such as restless patient or poor cooperation patient, or it leads to phase encoding errors. How to correctional technique? By patient immobilization, good positioning, and clear instruction to patient. Or for breathing, we can use breath hold sequence, or we can use ECG or respiratory gating to simulate the beat, or can use faster imaging, parallel imaging, or single shot FSE. So, example of the image shows boosting artifact where repeated outlines, such as those of eyes or vessels. This appear due to involuntary eye movement. The eye outline may be double. So next artifact to discuss is aliasing artifact or wraparound artifact. It occurs when the field of view is too small. Then the tissue outside the field of view is incorrectly mapped inside the image boundaries. It shows like overlap image. From the image, you can see the overlap image. So correctional technique, increase the field of view, apply anti-aliasing filters or no phase wrap, or swap phase and frequency encoding directions. The artifact is susceptibility artifact. It occurs at air tissue or metal tissue interfaces such as dental filling, surgical clip, or hemorrhage. It may also cause bilocal magnetic field distortions due to difference in magnetic susceptibility. So the image shows how the susceptibility artifact will be looking on the MRI image. So the correctional technique, use spin echo instead of gradient echo sequence, apply higher bandwidth, use metal artifact reduction techniques, and position patient to minimize artifact region if possible. So these are my reference. Thank you.